Acute blood loss anemia can occur because of certain causes, and that many times is trauma, surgery, or can even be because of aortic dissection. And the signs and symptoms the patient will experience depend on the amount of blood that they have or are currently losing. So signs and symptoms might range from being orthostatic, which is mild dizziness and a drop in blood pressure upon getting up. They might also be tachycardic and hypotensive as that blood loss becomes more severe. With even more blood loss or a moderate amount of blood loss, the patient might be short of breath as their oxygen carrying capacity is decreased, and they might show diaphoresis and altered level of consciousness as the blood perfusion is shifting to the major organs that require blood flow rather than the skin, and then the patient becomes altered because there's decreased flow to the brain, blood flow to the brain. And eventually, if not detected early, this acute blood loss anemia can lead to shock, hypovolemia, and eventually death. So make sure you check your patients that are either coming out of the operating room, are trauma victims, or have some sort of disorder with their blood vessels very frequently for signs and symptoms of blood loss, and make sure you trend their vital signs very diligently to detect any signs and symptoms of acute blood loss very early so that you can intervene and save their lives. For more information, please check out the full video on YouTube about acute blood loss anemia.